There are many different types of symptoms a person with schizophrenia may suffer, which will affect how one feels, thinks, and acts. Not all symptoms will be present in everyone. The most common sign and symptoms of schizophrenia is psychosis, where the person cannot tell reality from fantasy, and includes hallucinations, delusions, disordered thinking and behaviour. Hallucinations are the most experienced form of psychosis, affecting 70% of people with schizophrenia, presenting as auditory, visual, olfactory, or tactile. Some other signs and symptoms include social withdrawal, insomnia, and lack of sleeping, confused thoughts, mustered speech, trouble concentrating, hostility, lack of personal hygiene, and lack of emotion. Visual and auditory hallucinations are often angry and demanding, telling the person what to do, saying extremely mean things, and can be very frightening. Antipsychotics work to control symptoms by affecting the neurotransmitter, which are chemicals that the brain uses to communicate by travelling to different parts of the brain via neurons and dopamine in the brain, as overactive dopamine assists in producing hallucinations, altering the brain chemistry. Moreover, antipsychotic medications block the D2 receptor, a subtype of the dopamine receptor. There are two types of antipsychotic medication: atypical antipsychotics and typical antipsychotics. Atypical antipsychotics are second-generation or modern antipsychotics and cause less side effects, however do tend to increase weight or diabetes due to the increase of hyperglycemia and drowsiness. Typical antipsychotic medications are first-generation antipsychotics, being first designed and created in the 1950s. Typical antipsychotics are known to cause both short-term and long-term side effects, some of which include extrapyramidal effects, autonomic effects, endocrine effects, an increased risk of seizures, dry mouth, and drowsiness. There is also the increased risk of developing tardive dyskinesia, a condition where the body makes involuntary movements, such as twisting or sticking out of the tongue and chewing of the jaw. Larger limbs, such as legs and arms, can also be affected. Approximately 1 in 5 patients using typical antipsychotic medication develop tardive dyskinesia, with an average prevalence across all ages of 30%, 5% younger and 20% older. Typical antipsychotics are often only prescribed when atypical antipsychotic medication is not effectively controlling symptoms. Antipsychotic medication can be prescribed and taken in two ways: a long-lasting injectable and an oral tablet. It is to be noted that dosage is dependent on the individual. However, due to only existing for first-generation antipsychotics for a long time, only certain generation antipsychotics are available as an injection, including risperidone, olanzapine, aripiprazole, and paliperidone, only needing to be given every 2 to 4 weeks. Oral antipsychotic medication is usually taken 1 to 2 times a day, with behavioural changes occurring within 24 hours and psychotic symptoms being controlled within 2 weeks after. A person with schizophrenia will commonly have to take antipsychotic medication for the rest of their life, as it does not cure, but instead controls symptoms of schizophrenia.
I see this girl. Every day she'll torment worse, worse and worse. It won't stop. I fear for my safety, and yours too. You should be scared. I'll do anything, doctor.
Look, you need to understand that I cannot simply provide you with antipsychotic medication. To prescribe such medication, I need to ensure that it is the correct, viable dosage and specific prescription, as well as recognising possible ethical violations, cautiously considering morals and the action of doing good without causing any harm to you as the patient. I also need to consider whether you are competent enough to make the decision to agree to taking antipsychotic medication. Not only a moral obligation, but also a legal one, is the need to assess your ability to competency, which can be impaired due to your condition. It has been found that patients with schizophrenia usually lack the ability to make correct, informed decisions. This is due to a decrease in understanding, retaining and processing of information, combined with cognitive impairments and neuropsychological deficits. To help improve your decision making and understanding whilst having an ethical understanding that you can still make some capable decisions, I can use a refined and specific explanation to increase comprehension. Adolescents account for roughly 20% of the schizophrenic population, with a rise of 0.23% in 2005 to 0.32% in 2012 for antipsychotic medication prescriptions in Germany. In America in 2006, antipsychotic medication prescription for adolescents 17 years and below was at 14%, contrasted to more than 100,000 prescriptions in Australia 2013, equating to 12,000 adolescents. The most common antipsychotic prescribed to someone 10 to 14 years old is risperidone, where in 2013, 28,304 adolescents were taking the medication. However, clozaril, also known as clozapine, has been seen in a randomized trial to persistently and customarily outperform any other antipsychotic. Yet, the year-long experiment also presented that risperidone better controls hallucinations in an injectable form, having a relapse rate of 5% compared to 33% for oral tablets. While there are no age restrictions for antipsychotic medication prescriptions and use, I do face other legislation. Due to current Australian law, I'm not able to force you to take any antipsychotic medication, even if you are immensely suffering, and only have the ability to treat you when I believe that you are a danger to yourself and your society. This is unfortunate, as recent 2012 research has suggested that by myself, a doctor, having to make an almost impossible prediction of harm can lead to psychosis worsening due to it being untreated. However, I do have the authority to invoke an inpatient treatment order, known as ITO. An ITO is an order that I can employ to you which will require you to get the treatment I wish to provide, regardless your incompetency to consent or inability to agree. I'm only able to do this when there are no other alternatives and you are at high risk of harm to yourself or others, or are extremely ill. When prescribing you with an antipsychotic medication, there are a range of avenues in which I have to ponder in order to prescribe you with the most beneficial medication. I have to associate its effectiveness with your primary symptoms. For example, your hallucinations, its price, the impact of such side effects, your accessibility to it, and how often you'll be required to ingest or inject the medication. Essentially, I need to examine risk versus benefit. While there are many possible side effects, the consequence of not prescribing you with an antipsychotic medication may result in being potentially fatal. After examining you, your situation and the circumstances, I have come to the conclusion that I will be providing you with risperidone in tablet form, as you may not yet feel comfortable with an injection. However, if you feel more at ease with an injectable, please voice that. By taking risperidone, you are at decreased risk of 0.5% of heart disease, and your cholesterol levels will be lowered, eliminating some side effects. If risperidone is not making a positive impact, I will need to give you an extensive review, as well as considering the possibility of changing you to clozaril, which is often used when other antipsychotic medication is not working. We will also provide you psychological treatment and contemplate the idea of combining antipsychotic medications. There is an increased risk of smoking and suicide for you as someone with schizophrenia, hence the need for psychological treatment. Adding another antipsychotic with your current prescription has shown positive effects, having an increased rate of attendance to help programs. I'm also going to provide you with information on 2 other treatments that will help benefit you. The first is social skills training, a form of psychotherapy that improves one's social skills, ensuring social competency, and is suggested to be completed in a group setting. The second is cognitive behavioural therapy, a remedy that will help you find yourself and battle negative thoughts through practical strategies. I must also inform you that most patients complain of a feeling of dullness when taking antipsychotic medication. This is completely normal, however all symptoms will be reduced and controlled. But please do not be scared, you're in safe hands, and with effective and appropriate treatment you will live a happy, fulfilled life.
Take the pill, and you're even stupider than I thought. I'll never leave. I'm here forever. The only way to escape is to kill yourself.
I'll do it. Just tell me where to get it and I will.
You're useless. Kill yourself. You're unloved. No one wants you.
I'll take this medication, it works, it does. People are missing out just because of hallucinations like you. I won't give in, I'll live.
While antipsychotic medication does have extremely positive effects, it all has extensive negative impacts too, such as tardive dyskinesia and autonomic and endocrine effects. Not only can the side effects be life-damaging, but antipsychotic medication also causes the long-term user to die approximately 19 years earlier. This is essentially taking away one's life and is particularly concerning for the 16,570 users aged 17 and under. Risperidone is the most commonly prescribed antipsychotic medication, yet it is the one antipsychotic that is and has been involved in numerous lawsuits in the United States. This is due to the uprising and conflict of interest between psychiatrists and doctors prescribing the medication and pharmaceutical companies, suggesting that doctors are working with the pharmaceutical companies to make more prescriptions. A similar situation has arisen in Australia, where there are concerns this happened in the 90s, where a manual for early psychosis was given to and funded by the Janssen CLAG. There is no legislation in Australia in regard to this. However, America has taken the stance to protect their citizens and enforce that all doctors receiving a sum of $100 or more from pharmaceutical companies are to be named and investigated.
Children waiting for the day they feel good. Happy birthday, happy birthday. And to feel the way that every child should sit and listen, sit and listen. Went to school and I was very nervous. No one knew me, no one knew me.
Therefore, it is, in some cases, not completely ethical to provide the medication, however commonly is, due to the need to think of the wider community and the safety of one and others. It has also proven viable, where they complete their job of controlling symptoms and helping the patient live a happy, free life and are continuing to be improved. Yet, they can be debated to not be a viable option due to the brain-damaging effects.
People run in circles, it's a very, very bad